Okay, so good afternoon, everyone. And welcome to case discussion in the series. This is the 15th one that we have, and I'm extremely proud, happy, and honored to have Pooja Kewalramani with me. And a big thank you to the audience for making it in between your work days. Several of you are working, several of you are at the clinic. So thank you so much for logging in at this time. Pooja is going to keep it very crisp and interesting for you. I will quickly introduce Pooja to you guys. So, one second, let the screen come up. So, So, Pooja Kewalramani, she has worked as an audiologist as well as a speech language pathologist at Shabda Brahma Speech and Hearing Clinic. She has also worked extensively in rehabilitation of children as well as adults with cochlear implants. She has worked at an early intervention center for children with multiple disabilities as a speech therapist and has also provided honorary services as a SLP at Blind People's Association, and which is the MSM NAS Summer Scheme Respite Care Center for Children with Autism, Cerebral Palsy, Mental Retardation, and Multiple Disabilities. She has also worked with children with deaf blindness and multiple disabilities and presented a lecture at regional training on deaf blindness on assistive devices in speech and hearing. She has worked as a consultant as well as a freelancer speech therapist and is presently working as a consultant SLP, ASLP at Blind People Association, Ahmedabad. Pooja, I'm incredibly happy to have you here, and you are incredibly privileged to be happy, sort of helping children with multiple disabilities and deaf blindness. Not all of us get to do it and make a sort of a difference. So welcome, Pooja.
Thank you so much. Thank you so much.
And please go ahead. You can share your screen and you can start.
Is it done?
Yes. Just go to slideshow now.
Okay. So, a very good afternoon to all of you. And once again, welcome you all to today's case presentation. So, as Debosmita has introduced me, once again, thank you for inviting me and giving me a chance to do a case presentation here. So, today the presentation is on challenges in speech and language development in a child with visual impairment. So what mostly we all work with is children with children with hearing impairment, cerebral palsy, autism, voice cases, all kind of disorders. But visual impairment or multiple disability is a area where we all don't get a chance to work with. So today I would like to highlight and present on the challenges which I face in that. Before I begin, I would like to quote something by Helen Keller, which says, blindness cuts us from things, but deafness cuts us from people. There is one more very good quote by ma'am. Blindness separates people from things, but deafness, it separates people from people. So when you don't hear, you are completely cut off the world. Blindness is one aspect which gets cut off, but deafness completely cuts you off. Coming to my today's case, the child, age is 10 years, male child. Yes. History of full-term cesarean delivery. Child was kept in incubation for 1 week. There was inability to open eyes since birth. And the child's first eye sonography was done at 1.5 months of age. and the child has certificate of complete blindness. Motor milestones were delayed, speech milestones were delayed, and child was mostly babbling in the early years. He started attending BPA school, that is the Deafblind DB Unit Center, since 2021. That was the age of 7 years. Coming to oromotor assessment, lip seal was inadequate, tongue movements were inadequate, even mouth opening was inadequate. So the status was visual impairment with speech delay. Coming to preschooling status, before starting with the center, child wasn't able to tolerate any other person's touch, place, even loud noises. All activities of daily living were affected. See, basic things like brushing. The mother used to clean his mouth with a cloth. He did not like the touch even in brushing. He used to eat only crushed food like dal rice, biscuits in milk, such kind of things. Child started coming to Blind People's Association, Center for the Person with Disability, the Deafblind DB unit, since 2021. It was then when the child even started attending occupational therapy. That continued for 3 years. Now, since 6 months, the OT has been stopped. Speech therapy started from 11th of December 2023 and it is still ongoing. So this is a video shared by his mother of the early years when the child had only babbling. Till a very long period, it was only babbling. So let's see how it was. It was mostly ta 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 ta, this kind of babbling. Yeah. So coming to speech and language assessment. So comprehension, child comprehends questions who, what, where, comprehends bidirectional commands, use of objects, comprehends all verbs and basic understanding of things of daily routine. Coming to expression, child mostly expresses in one word utterances. Mostly it's one word that is also not clear. Sometimes uses phrases and few sentences like pani apo, pani do. Speech is not clear. Child uses less sign language, but for certain words, child uses specific signs, like for fruit names, vegetable names. He has specific signs, which you will see in the upcoming videos also. Repetition is a lot. In expression, mostly it's repetition. So there was increased repetition at the time of assessment. Verbally, meaningful speech is less as well as it was unclear. So I just wanted to find out a language age. So I did reels. So in reels, it was showing the receptive age was coming to 30 to 33 months. And the child is already 7 years. So 7, no, sorry, 8.5 years when we started therapy. And the expressive age was coming to 22 to 24 months. So there was a huge gap between the chronological age and the uh, actual age of expression and reception. Yes. So they got a audiogram done in 2023, which said normal hearing sensitivity in both the ears. So this is the audiogram. Coming to therapy goals, the long-term goal was to improve speech clarity to at least 50 to 60% from the current level, to improve comprehension at an age-appropriate level, to reduce repetition and increase meaningful speech, and overall, the long-term goal was to improve the communication skills at least from a word level to a sentence level. So coming to short-term goals, my first goal was to improve the speech clarity. So for that, firstly, I started oromotor exercises. So E, that lip exercise was started. Lip massage was given to achieve the lip seal. Tongue lateralization exercise was done. Right to left using a honey and lemon juice. Tongue elevation was done at a later stage. Open mouth approach practice was explained and introduced, and parents were told to continue all these exercises at home. Open mouth approach actually helped a lot in the clarity part, which you will see in the videos also. Also, considering the clarity aspect, I worked with few misarticulations along with the other aspects in the beginning itself, considering it would be helpful in the clarity. So to begin with, I started with paw sound. So it was paw, na, ka and ta initially, one by one. Although results are not 100%, but working with particular sounds helped in the intelligibility. Next was in comprehension. Firstly, yes-no concept was introduced so that basic communication at home, like at home, it was signs and verbal both. So yes-no was introduced, like brush karyu, to ha. Brush kiya, ha. Tube चालू है तो हाँ, like that. Yes concept was introduced. And then basic questions were taken to work on expressive skills, because questions already he understands, but expression part was something which was missing. So as I told you, it was a challenge. It's a case of visual impairment. So we used big size pictures and mostly real objects, which the child used to touch, feel, and then he would say, okay, yeah, this is a pen or this is a phone, like that. So example, like what is this? So this is eyes, like that. So simple objects were used, big pictures were used, and very basic level we started, so that the basic communication first starts and then we go to advanced things. Then before moving on further, like phrases and sentences, action verbs were taken, because that is something we use in daily routine. Like in questions, a choice of phrases were started, like pani do, chai do, roti de do, like that. So after 8 months of therapy, this is what we could observe the changes.
वीर नास्तो કર્યો નાસ્તો કર્યો બેટા ઓકે લાઈટ ચાલુ છે
Light
મમ્મી આયા
perception.
છે ક્યાં છે મમ્મી નીચે પપ્પા આયા છે પપ્પા આયા છે પપ્પા આયા છે સ્કૂલે હા કે ના પપ્પા પપ્પા નથી આયા ને ના તે બ્રશ કર્યું સવારે બ્રશ કર્યું તું બ્રશ કર્યો હા કે ના? ઓકે. તું ગરબા રમવા ગયો તો? ગયો તો?
So this is articulation therapy.
ટ ટા ટી 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 ટુ ટ ટાટા ટા વેરી ગુડ. ટીવી ટી વેરી ગુડ. તું ટીવી જોવે છે? જોવે છે? થોડું થોડું જોવે? ઓકે.
So this was what improved after 8 months of therapy. Coming to not only discussion but the key points which have played an important role. Firstly, the role of mother. As we all know, mothers play a very crucial role in a child's development. Similarly, here also, it was the mother teaching the child all throughout before joining school. Like I mentioned, he joined school at 7 years of age, post COVID. So, up to that age, it was all done at home. She was the only one who could understand him, as the child uses a lot of gestures along with verbal expression. So, after they started coming to BPA, child achieves significant improvements in all activities of daily living. Now he brushes, he eats all types of foods, all textures. After 2 years of intervention, now the child has joined school for the blind and he studies in 3rd standard in the blind school. With the help of school, Braille was introduced for the child at the school. Braille is a language used by the blind people. So Braille got introduced at the center also as well as at home since it started at school. So the mother has also worked very hard with him to teach him Braille. Now currently the child knows Barakhadi in Gujarati language up to na sound like ka, ka, ki, ku, ke, kau, kam, kaha. Similarly, till na sound he can write in Braille. Also in the maths Braille, there's a maths Braille board which is separate. In that also he writes numbers from 1 to 20. I have a short video which shows how it goes in Braille. So he will write down now. He's writing it.
પછી ગ પછી ઘ પછી ચકલીનો ચ પછી છ પછી જ જામફળનો જ પછી જબલાનો જ પછી ટપાલીનો ટ પછી ઠળિયાનો ઠ ઠળિયાનો ઠ પછી ડમરૂનો ડ
પછી ઢગલાનો ઢ, પછી ફેણનો ણ, પછી તપેલીનો ત, પછી થાળીનો થ, પછી દડાનો દ, પછી ધજાનો ધ, પછી ન, લખો ન, પછી પતંગનો પ, પછી ફટાકડાનો ફ, પછી બ બકરીનો બ, પછી ભ લખો, ભ મેળાનો ભ, પછી મરચાનો મ, પછી યતીનો ય, પછી રમકડાનો ર,
You want to skip ahead, Pooja?
Yes, yes, yes.
Please do, please do. Or you can stop it also, yeah.
So this was how he's learned Braille. Coming to prognosis, considering all factors, there has been a significant improvement in speech and language comprehension as well as expression. Also, as reported by the mother, now, like after so much 1.5 years of therapy, now the child mostly prefers verbal communication. His use of signs has also reduced. You will see in the upcoming videos, like he has sign for every fruit, every vegetable. He has specific signs, but that has reduced and he prefers verbal communication. One challenge which I observed was the child needs a lot of repetitive drills to maintain consistency. Even repetitions at times will reduce, at times they increase also. So it has to be regularly tracked. So like we say, the teamwork has to continue. So there are few videos which I would like to share.
લાઈટ ચાલુ છે? હા કે ના? અચ્છા, તું કુર્સીમાં બેઠો? તું કુર્સીમાં બેઠો?
This is of yesterday. These videos are just of
હા કે
yesterday.
ના? તું શેમાં આવ્યો? સ્કૂલે કેવી રીતે આવ્યો? શેમાં આવ્યો તું સ્કૂલે? ગાડીમાં કે બસમાં? આખું રિપીટ નહીં કરવાનું. શું શેમાં આવ્યો તું? સ્કૂલે શેમાં આયા તમે? ગાડીમાં આવ્યો કે બસમાં? શેમાં આવ્યો? બસમાં આવ્યો ને? હા કે ના? તો શું કહેવાનું? બસ. હા, હું બસમાં આવ્યો. બસ. અને તારી જોડે કોણ આયા સાથે? તારા સાથે કોણ આવ્યું? નીચે કોણ છે? કોણ છે નીચે? નીચે કોણ છે? મમ્મી છે? ઓકે. આ શું છે?
He has signs for everything.
આ કયો ફ્રૂટ છે? આ કયું છે? જો જો તું બરાબર જો. કેરી છે? હા, કેરી. પછી આ વેરી ગુડ. આ કયું છે? દ્રાક્ષ હે ને? ઓકે. આ શું છે? તને ભાવે ભીંડા? ભાવે? હા. બટાકું. આ શું છે? હા. વટાણા. વેરી ગુડ. આ શું છે? ડુંગળી. પછી આ શું છે? દૂધી છે? આ શું છે? દૂધી? અચ્છા. તને કયું ભાવે ફ્રૂટ? સોરી, શાક કયું ભાવે તને? તને દૂધી ભાવે કે ભીંડા? સરસ કયું? હે વીર? દૂધી કે ભીંડા? કયું સરસ? ભીંડા? તું ટિફિન લાયો? લાયો છે તું ટિફિન? હા કે ના? ઓકે. શું લાયો ટિફિનમાં? રોટલી લાયો? રોટલી? શાક લાયો તું? હા કે ના?
So this is on use of objects, which we had been working on for us quite some time.
વીર આ શું છે? લખવાનું? અને શું કહેવાય? પેન. વેરી ગુડ. આ શું છે બંને? ચાવી. અને આ તાળું છે? શું કરવાનું? ચાવીથી શું કરવાનું? ખોલવાનું. અને બીજું બંધ કરવાનું? પછી આ શું છે? પાણી પીવાનું. શું કહેવાનું? પાણી આપો. આપો. ચલ. આ કયો કલર?
Few colors he can see and identify.
લાલ. વેરી ગુડ. પછી આ કયું કલર? ના, બરાબર જો. લીલો છે બેટા. અને આ પીળો કલર. સરસ. અને તે શું પહેર્યું? આ શું છે? આ પેન્ટ છે ને? અને આ ટી શર્ટ. વેરી ગુડ. ચલ આપણે પ્રેક્ટિસ કરીએ. ગોપી, પપૈયું, પીળો, ટોપી, કપ. કપ કપ. આપો. પાણી આપો. આપો. ગણપતિ બાપ્પા. બાપ્પા. ઉપર. ઉપમા.
This was his conversation with his teacher who worked with him. So,
મજામાં છે? હા કે નામાં કહેવાનું? હા, વેરી ગુડ. ચલ આપણે પેલું ગેમ રમીશું નાની આમ ચોરી વાળી. કભી આગે ચલો આપણે રમીએ. જો ઉપર ઉપર આમ કરીએ આપણે. ઉપર આમ કરવાનું. જો ઉપર ઉપર, કભી નીચે, કભી આગે આગે, કભી પીછે. પીછે એટલે હાથનો પાછળનો ભાગ, હે ને? હા. ગમે તને આવું રમવું? ગમે રમવું ગમે છે વીરને? તાલીવાળી ગેમ ગમે છે? આ તાલીવાળી ગેમ વીરને રમવી ગમે છે? હા કે ના? હે, ઓકે. કાલે આપણે રમીશું, હે ને? રમીશું ને બધા સાથે? હા. પછી તને બીજું શું ગમે? બોલ રમવો ગમે? વીરને બોલ રમવો ગમે? હા કે ના? પછી વીરને હિંચકા ખાવા ગમે? હિંચકા ખાવા ગમે? હે, બહુ ગમે? બહુ ગમે? આજે સવારે વીર ગયો તો હિંચકા ખાવા? હિંચકા ખાવા ગયો તો? હા કે ના? હા, મેં જોયો તો તને. હું સ્કૂટર લઈને આવી ને, મેં તને હિંચકા ખાતો જોયો તો. મજા આવી તને? વીર, તને મજા આવી? હા, વેરી ગુડ. વાહ ભાઈ વાહ. પછી તું બસમાં આવ્યો સ્કૂલે? ઘરેથી સ્કૂલે બસમાં આવ્યો આજે? વીર ઘરેથી સ્કૂલે બસમાં આવ્યો? હા કે ના? સરસ.
these are some of the achievements. They have annual day. 14th September is the flag day for the blind. So the institute has an annual day, and all their kids, all the disabled children participate. So this is one of the pictures, and this is the school photo, which I thought to share it here. So let us now discuss more. Your insights can, I think,
You
can
already
help out
have
to do better.
you already have questions, Pooja. So
Okay.
you can stop sharing. You can stop sharing the screen, then you will come on the main screen. So even though he was certified completely blind, he can see a lot of things. So was later anything done, like the percentage of the vision or something of that sort?
No, his certificate says complete blindness.
But he can see so many things. Like before you're asking, he can see your it's okay. Yeah. He can see your hands also when you were also signing. What is this?
Yes.
So bringing the object
Yes,
close
yes, he
by.
can. Even that the room where I work, it's a sound treated room. So thoda bhi darwaza khula. So he knows light comes inside. He knows that the daylight is coming. He even knows the geography, like from
Okay.
his classroom to the speech therapy room, it's a walk. So if they send him alone also, he comes.
All right.
Even at his house, कौन सी
Yeah.
चीज कहाँ पड़ी है, everything, he is independent enough. He knows.
Okay. Even when
But
you
the
were
only
bringing
thing
the
is,
yellow color puzzle close to him at a distance of 3 or 4 inches, he said it is yellow color when you were
yes,
showing him the
yes,
puzzle.
basic colors also he knows.
Okay. So one question was in the chat box about his blindness. What is the person? How is the child able to see? That means, yes, he is not
Actually,
completely blind.
it's not, but physically he's not able to open the eyes. I think on that grounds, the
Yeah,
certificate says complete blindness.
correct.
But probably it's on a physical basis, not functional,
Yeah.
probably.
not functional and
yes,
not
yes,
later
yes.
maybe, because when you said he has picked up signs, that means definitely he has seen it,
Like
like
for
this
dungri, like for onion, he does like this, dungri,
for
because
crying.
yeah,
Yeah.
he does that. So he has specific signs for everything.
Yeah, so that means the science he has definitely picked up by looking, or at least partial perception of what the mother has
Yes.
taught. Correct. I also wanted to ask you, like within a period of 2 years, how he trusted your touch to go from an open mouth posture to, not accepting textures, to accepting textures, closing his mouth and articulating, because the articulation is also greatly affected because of his inability, because he was not,
Yes.
like he was
Like
not,
for Ter also, I had put, we use a ice cream stick. His mother used his finger and she showed him where to put it. After that, he started, कि chalo, this is Ter. That's
okay,
how slowly we worked with few sounds.
okay. And that is how he accepted your oral motor treatment also, to
Yes,
close and accept a
yes,
variety of textures for eating also, right?
yeah. In that, occupational therapy helped a lot
Okay. So,
because,
huh,
yeah, because initially he was not accepting, but then slowly, now to in fact he comes to the class without his mother. His
okay.
mother did a course, a community-based intervention course in the institute, and now she works as a vocational training teacher.
That
So
is
now
excellent.
she doesn't, she's not always there in the session, but
Very
now
good.
he happily comes for the class.
Yeah, much more accepting, right?
Yeah, very much accept.
Okay. So, no, especially with the oromotor, a child who has like partial sight, but still was not able to close the mouth, like you said, the first thing you said was mouth was not closed and lip seal was not adequate, and then
Yes,
came the texture. So
yes,
definitely over there, like the intervention, both the OT as well, you helped a lot, because unless
yes,
that is in place, definitely you can't, work with any articulation, any placement at all, basically. Okay,
yes.
I also wanted to ask you, why did it start?
Also,
Yeah,
somebody has
go.
asked, total blindness, can't see colors.
Yes.
Exactly. It's probably the certification is on the physical basis and not the functional basis. There
Okay.
are things which he can see. Even there is light perception.
Yeah.
So, yes, it
You
is true.
did ask him. You and the teacher both asked, is the tube light on? And he was very quick with the answer. Like,
Yes, every time we ask him, he's very quick. Tube light
yeah.
chalu hai.
So
Fan
that
chalu, tube light, everything. Yeah,
Yeah,
it's
so
quick.
that means definitely, like it is not complete blindness in terms
No,
of functional, and
no.
definitely after the first time he has been able to see enough so that there is cortical rewiring also. See, it's not just corneal.
Yes,
If he is able to recognize all these objects also substantially, it has to be cortical for him to recognize things on
yes.
a repetitive basis. My next question was, why did you guys start off with his admission in the DB unit? Like, you were not sure because of his features, not
Yes,
sure.
probably because there's no hearing loss as such,
Yeah.
but all the blind children are in the deafblind unit actually in the center.
Okay.
They
Okay.
have divided centers.
Okay.
So children with visual impairment are in the DB unit.
Okay. Do we have to learn Braille to enhance speech?
No,
Did your knowledge of, huh,
Braille would be educational aspect,
literacy?
schooling,
Yeah.
academical.
Yeah. Braille would be literacy for him. Braille
Yes,
would be literacy for the child,
yes.
basically.
Literacy, yes.
Okay. Okay. But definitely, once you have worked at the articulation, because you are also, like you said, you have to keep repeating a lot, otherwise, he will not keep it up. So,
Simply yes, no is also a challenge sometimes.
yeah,
Like now I've started teaching him no. We have started doing likes, dislikes. Tanasu, what do you like more? So such concepts, it's not going very easily for him.
okay.
It takes a while to actually teach him.
Yeah. So that
That
that is
way.
the reflection of the cognitive part of it, right? That is
Yes, yes,
definitely
yes,
the
yes.
reflection of cognitive part, and obviously it throws, like you said, it throws a lot of challenge with the materials you're going to use, because even
Yes.
if not complete, there is a visual challenge, and the child may not pick up details of a small picture that you might be showing.
Like just to add on, there are two more kids. They have complete blindness. There's not even light perception to them. But hearing again is normal. But in spite of that, there is absolutely no speech coming.
Correct,
Considering age factor, delayed identification, and you know how we say parents give hand to mouth everything. Like
correct,
always, we counsel you have to create the need.
correct.
But just because the need is not created,
The
10 year
opportunities, yeah,
opportunity, yeah. Like age is now 10 years, 11 years. So now, even expecting that few words will come is a big challenge. It's a
yeah,
question mark. So then ultimately, we have to teach them signs
correct,
because there's absolutely no speech in spite of normal hearing.
correct, correct.
So
And
that also
yeah,
happens. That's why.
and those signs you have to teach manually, because there is no
मैन्युअली हाथ पकड़ के सिखाना होता है.
correct, correct, because there is no light perception also. So
No,
definitely, does
nothing.
working on auditory skills help in speech acquisition? I think by auditory skills,
Yes,
what
yes,
Sylvia means
it
here is the
does.
awareness, identification,
It
discrimination.
does, it does.
Okay.
Yes.
So you get them to respond in that hierarchical manner, like we do with when we fit hearing aids in very
Like
young
a
children.
very classic example for this would be how I was teaching him T. Like
Yeah,
T, he wasn't able to do. So then we repeated, made him more practice. Then he got it. It's not P, it's T.
correct,
So that was with auditory skills.
correct.
Yes.
Because even with that amount of vision, he definitely can't see the placement. T is
No.
anyway a hidden placement. It
Yes.
palatal placement is not very visible. So okay,
Like
okay,
curve was easy because curve, few words he knew, few he didn't know.
correct,
So then it was easy to tackle curve sound
correct.
that
But
way.
with this kid, like you're saying, as against the other two kids, with this kid, because he was identified pictures and he had signs,
The
there was
growth.
something to correlate to, like the onion. So that's the first sound of the onion.
Yes,
Yellow. So that is the first sound of yellow, like in
he
Gujarati
knows.
when you were saying it,
He
something
immediately said Lilo. Yellow is,
correct.
sorry,
Yeah.
Pedo. Yellow is
Pedo,
Pedo. Yeah.
yes. So
He
you can
immediately
connect,
said,
yeah, that this is a per for papa, per for pedo, as against a child without any, and a child who is not attempting speech. There is no correlation that you can create with other things and objects for
yes, that's
them
true.
to for them
That's
to
true.
kind of catch on. Because if you're telling this child knows everything in his house also, and not by
Yes, he
touch, by
does. Yes,
partial
yes.
vision, that is a lot. That is very good. Then
Yes,
it
yes.
is just the cognitive adjustment with which the parent has to then understand vocationally what he will do, and
Yes.
those kind of things. But yes, I think what you're underlying and you're saying is that yes, you do need a lot of practice for the child to keep up with those
Yeah,
language skills,
that is the challenge. Yeah, it is there.
Okay. It was very nice to see this, because you place them in the DB unit, deaf blind unit, and then you later said you was shifted to only the blind school, where I think your articulation exercises will help him majorly with the Braille, because then he can listen and discriminate. When
Yeah,
the mom was giving him dictation on Braille, that was
yeah.
Sylvia is asking you, how will be the multilingual language acquisition in blind children? Has he picked up maybe Hindi or some other
No,
neighboring
it's only Gujarati for him as of now.
Gujarati and Braille, right? Gujarati, and
Yeah,
then
Gujarati
in
and
term
Braille.
in
Correct.
terms of understanding the language, it would be Braille. I think so.
Like certain words which are common, like he knows, like Hindi, Gujarati, English. Suppose bus is a bus,
Correct,
for example. Those kind of words he knows, but
correct.
otherwise it's Gujarati and Braille.
Correct. But from what this kid you're showing, maybe he will pick up Hindi also,
Maybe, yeah, Hindi can be done. Yeah,
Hindi
probably.
definitely. It will depend on the
Probably,
exposure and if the
yes.
mom gives him, or if the family moves somewhere, then situational, maybe he will be able
Yes,
to
yes, yes, yes. That is
definitely
possible. That is
be able to
possible.
pick up. But it was indeed wonderful, given, they seek intervention at 7 and now he's
7,
10.
yeah. That the progress has been really good in spite of a late start.
Yes,
In
yes.
spite of a late start, yes,
So
definitely.
definitely a lot of credit to the mother, and also the
Yes.
child was able to pick from the environment. It was not that the cognition was that delayed, or
No, no.
cognitively those skills were poor. Even he could pick up a lot from the environment, I think so.
Yes.
That is great. So let me just check. Yeah. Okay. I don't think there are more questions, but thank you so much, Pooja, for this.
Thank you. It's been wonderful sharing with you all.
It is really very nice. I'll just share my screen. Thank you so much. If any of you have further questions or you want to discuss something about multiple disabilities, children with multiple disabilities, intervention techniques, wherever you saw this post, reach out to me, reach out to Pooja. She definitely will be there in her
Definitely.
on overlapping groups. Pooja, this is something very small as a token of love and
Oh,
appreciation
thank you
for
so much.
everybody's, even you're busy in practice, everybody's busy in practice for getting the time to put this together and share it with the all of us.
Thank you so much. Thank you so much.
Thank you, Pooja, for presenting, and thank you to the audience. Thank you, Vitali ma'am. Thank you to
Thank
the
you so
audience
much,
also
everybody.
making it on a, in the middle of a Saturday afternoon. So we'll wind up. This will be available for future references also. People can definitely watch this. Okay,
Thank you so much.
welcome, Pooja, and thank you. It was really wonderful. See you.
Thank you. Yeah. See you.
Bye.
Bye.